I'm Tori, and today I'm going to be talking about how to do oral cares for mechanically ventilated patients. So the reason that we do oral cares is to help prevent ventilator-acquired pneumonia in these patients. So we're going to perform these oral cares every 2 hours on these patients. So the first thing we need to do is introduce ourselves, wash our hands, and apply appropriate PPE, including gloves. And then what we need to do is inspect the ET tube for any issues. Then the next thing that we're going to do is we're going to go ahead and suction out our patient's mouth. So we're going to attach this part to suction, -100 to -120, and then we're going to use a suction catheter. We're going to suction inside the patient's mouth to get any of those secretions that are sitting in there out for our patient. Then the next thing that we're going to do is brush our patient's teeth. So the toothbrush will also go on top of the suction. And I don't have the toothbrush, but to use it, what you're going to do is you're going to get some of the toothpaste sort of like solution on the brush. You're going to brush the patient's teeth top, bottom. You're going to brush the inside part of the teeth, the outside part toward the cheeks. You want to make sure you're brushing the front teeth, the back teeth. You're going to do that in a small circular motion. You want to make sure that you're not doing it too rough as to cause the patient pain, but also not too gentle. Otherwise, you're not going to be getting those teeth as clean as they need to be. So after we brush the teeth, we turn on the suction and we get that all suctioned out of the mouth. After we have done that, we need to apply a mouth moisturizer. So we'll put a little bit of this on the swab. We're going to swab the cheeks, the gums, the tongue, the top of the mouth, the whole inside of the mouth, as well as the lips, so that we can keep that moisture for our patient. And then after 2 hours, we'll come back and we're going to use the suction catheter. This is going to allow us to get farther back into the throat beside the ET tube. So we'll be able to kind of move the ET tube a little bit to one side to suction behind as well as the other. That's a good time to check for the skin integrity, make sure there's no breakdown. And so then after that's done, 2 hours later, we'll come back and we're going to use this attachment, which is very similar to the toothbrush. We're going to dip it in this little solution. It's sort of like mouthwashy, toothbrushy type of solution. And again, we're going to clean the inside of the patient's mouth. We want to get the cheeks, the gums, the tongue, the roof of the mouth. We want to go over the teeth. We want to get all of those internal surfaces of the mouth clean. And then you can turn on the suction and you can suction that all out of there. And then again, when you've finished with the cleaning, you need to go ahead and moisturize the mouth again the same way. The whole inside of the mouth, cheeks, gums, tongue, roof, as well as that patient's lips. And then once you're done with those oral cares, it's always good to re-inspect the ET tube, and you can check your patient's vital signs again at that time. So that is how you perform oral cares for ventilated patients.